Welcome to SVGTV News for Thursday, October 21st, 2021. I am Rochelle Batiste with the details. 57 new COVID-19 positive cases were reported here from 406 samples collected on Wednesday, October 20th, resulting in a positivity rate of 14%. 30 rapid antigen positive results were also reported from flu clinics Wednesday. There are currently 3 patients admitted for COVID-19 at the Argyle Isolation Facility. All are said to be unvaccinated. 33 patients have also been admitted to the COVID-19 wards at the Milton Cato Memorial Hospital. 31 of these patients are unvaccinated, 1 fully vaccinated, and 1 partially vaccinated. No new deaths and no new recoveries were noted over the reporting period. 1,756 cases are currently active and 56 persons with COVID-19 have died. 4,786 cases of COVID-19 and 2,974 recoveries have been recorded in St. Vincent and the Grenadines since March 2020. The health authorities say in view of the confirmed presence of the Delta, Mu, and Gamma variants in the community and a significant increase in the number of new infections, transmission, severe COVID-19 disease, and deaths, strict enforcement and compliance with all protocols and recommendations by everyone is strongly recommended. The correct and consistent use of masks, avoidance of crowds, physical distancing, proper hand sanitizing, and immunization with available vaccines have all been proven to significantly reduce the risk of being infected, getting sick, and or dying from the COVID-19 virus. Prime Minister Dr. Ralph Gonsalves has reiterated his appeal for nurses in the country who are among the list of frontline workers to get vaccinated. On radio yesterday, the Prime Minister said so far 57% of the nursing staff at the hospital and 63% in community nursing districts have been vaccinated. Though this signals an uptick in the vaccination rate among nurses since the last stats were provided in July, PM Gonsalves said the numbers can still be better.
Those numbers in around the middle of July, it was under 20%. So that we have made some progress since then, but not enough. We should have these numbers much higher than 57%. And there, as you would suspect, in the hospital services, there are wide variations between different wards. The maternity ward continues to have the bulk of them unvaccinated out of 37. Only 9 are vaccinated, 28 unvaccinated.
The Prime Minister further outlined some of the districts and the communities and hospital services that are doing well with vaccination. However, he said improvements are still needed.
Much better in the community nursing service than in the hospital services. But it must be said that both of them, we are seeing improvements. At Lewisburn at home, which is really a disappointment because you're dealing with old persons. You have 34 staff members, only 13 are vaccinated and 21 unvaccinated. So I'm calling on all the nurses and nursing assistants, all the staff in the hospital services. Let's go and get vaccinated now.
And as of Monday, October 18, 2021, 514 police officers with the Royal St. Vincent and the Grenadines Police Force have taken the jab, of which 348 are fully vaccinated and 166 partially vaccinated. Providing the figures on the radio yesterday, PM Gonsalves said 635 police officers are yet to be vaccinated, with 8 on study leave.
I'm told by the Deputy Commissioner, Frankie Joseph, that there has been a pickup over the last week from the 14th, this particular week.
Okay.
But this number, which is 514, and who have taken at least 1 vaccine, that's full 2 doses and also 1 dose. 514, that's 45%. That's on Monday. But I'm told the number is over half now. Okay. Because we have had some uptick over the week.
One of the departments of the RSVG police force that PM Gonsalves is hoping to see more officers vaccinated is the fire department.
Fire, which wasn't doing so well, I understand that more persons that fire have become vaccinated, and I hope all the members that fire there, that's close to 90 persons in fire. I really love to see all of them vaccinated, and like as in everywhere else, the Coast Guard had more than half.
A pandemic of the unvaccinated has been a concern for health officials here, and 8 months on since vaccines arrived in the state as a defense against the deadly COVID-19 virus, the country's vaccination numbers are not encouraging. Chief Medical Officer Dr. Simone Kizza-Beach said the data has proven to be correct that SVG is experiencing a pandemic of the unvaccinated, which is triggered by variant contributing factors.
The Gamma is known to be a quick spreader, spreads very easily, much more easily than the Alpha and the other earlier variants. And we think that is a major reason. Also, we have a population that sadly does not have the immunity that it might have if they were vaccinated. And so the majority of our cases, in terms of cases of coronavirus, are unvaccinated persons. We do have persons who are vaccinated, either fully or partially, so we have about 200 cases. But the majority of cases, the persons driving this current spike compared with the one we had in January, February, where we had no access to any vaccines. This spike is among the unvaccinated persons mainly.
The CMO said many vaccinations continue to breach the protocols put in place to stem the spread of the virus, hence the spike in infections.
This spike is among the unvaccinated persons mainly, and being triggered by the variants, which are extremely contagious, and also too where we have persons still not using their masks properly, consistently, and persons still gathering. Persons are gathering as if everything is usual, and we know once you have multiple persons in a smaller space, not using their mask, and you have a highly contagious variant, you're going to have spread.
Chief Lab Technologist Elliot Samuel said his team has cleared the backlog of PCR samples at the molecular lab. Speaking on the program on VC3 last evening, Samuel explained that the molecular lab was able to process more than 2,000 samples in a short space of time.
Was taken by the Ministry of Health and the extension the Cabinet of St. Vincent and the Grenadines, where we sort of temporarily transferred off a specific category of testing to the private sector. We have now been able to clear the backlog. As of last weekend, we were not behind. We would have cleared some 2,300 samples in a few days, because we were able to concentrate on getting that testing done, and we were not really bogged down by trying to get a test for somebody who was leaving the next day. And we are in a good space now, but we can't get too complacent, we can't get too comfortable, because there's a lot ahead of us, and there's a lot that is expected of lab services.
Now that the backlog has been cleared, Samuel said that the private labs will continue to do exit screening as they see it as a good government-public sector collaboration.
In my opinion, there's always a place for that public-private partnership. I mean, we have done it in other things. I mean, where clinical is concerned, we by no means, as the National Laboratory Services, is able to take on the gamut of all of the clinical testing, and that's why there are so many private labs, I mean, in country. And I mean, we saw the need where the private labs were there. They had the capacity, they had the training, they had the human resources to do it, and they have done it. And I think it's something that will and should continue in the future, where the private labs, I mean, once they're meeting the minimum requirement in terms of performing these tests to acceptable standards, they should be allowed to continue.
COVID-19 results are now issued every 48 hours. And the use of home test kits for COVID-19 are being considered by the COVID-19 task force. This is according to Chief Medical Officer Dr. Simone Kizza-Beach, who said certain persons will benefit from this initiative, including, especially teachers and students.
So is it that we move towards self-testing at home, and then you have a mechanism of reporting? So that is something we can think about even as we try to get our children back into school. Once we get a much better handle in terms of persons being confident enough to do the testing, being confident enough to report accurately to our healthcare providers. And there will still need to be that kind of follow-up. It could reduce the strain, but we also have to be very careful about the quality of testing and reporting and the capacity to even follow up on those test results. Maybe it's something we would want to use with the teachers who would have a level of the reliability so that they can say, okay, before I go off to school today, am I going to be doing a test? So it is something we would have to look closely and be very careful in terms of how we utilize it. I'll say that much.
Dr. Keza Beach noted that the COVID-19 tests are very expensive and that the reporting of results will have to be made to the Ministry of Health, which could be problematic.
The use of the home testing, which they have been found to be quite reasonable in terms of sensitivity and specificity, is not where we are at this point. Because really what's happening is that you're going to do a test, and if you find out a home test, you find out that you are positive according to the test. It's my understanding that you have to report that and that there may be some follow-up, or is it that you're going to stay home and monitor yourself and then come back out at the end of 14 days? So all of these are systems that have to be put in place to allow for something like that to function.
The CMO said that they have had reports of persons not being honest with their test results, more so those with a positive result.
Because once you get a positive, it will then be that we have to ensure that persons are willing to provide that information. Because already we have instances where persons are told that they're positive, they are advised and they're given their orders to stay at home and to isolate, and they don't. They don't inform their employer, they don't inform their co-workers, and they turn up to work, or they go out because they need to get something to eat. I understand that, but you don't expose other persons.
As of Wednesday, October 19, 2021, all schools that house persons who were displaced by the explosive eruption of Lasso Forever volcano have been cleared and are being sterilized, repaired, and cleaned for face-to-face teaching, which education officials are hoping will commence soon as part of the blended approach for the new school term. Prime Minister Dr. Ralph Gonsalves said the last two schools that had shelteries were moved to alternative accommodation on Wednesday evening.
Because there's the Bible Methodist School, which has 13 persons, and Kingston Government, which has 3. Those are the only 2 schools remaining. And they had the challenges because a couple of persons in those shelters had COVID. They should have been moved since Monday, I was advised, but I was told this morning by the Permanent Secretary in the Ministry of Education that definitely they're being moved into alternative accommodation.
The Prime Minister used the opportunity to give an update on other schools across SVG that are under construction or are being repaired.
There's a continuing at all the schools, and those which are being built, like the schools, the 2 schools out at the tarmac of at E.T. Joshua, they're being completed. I think they had a hold up a couple of places, including there with toilets. I think there was a shortage. Apparently, they had bought out so many toilets that the suppliers ran out. That's what I was told. The one in Beckway is going along fine, so the Beckway Community High School, and also they're finishing up at the replacement school up at temporary
Mount Young.
at Mount Young.
In some police news now, an investigation is ongoing into a report of burglary made by 77-year-old retired female real estate agent of Lodge Village against some unknown person or persons. The assailant or assailants reportedly entered the dwelling house of the complainant as a trespasser between 3 p.m. on October 8th and 12 noon on October 9th and stole a gold chain valued at 2,000 EC dollars, the property of the complainant. Persons with information that can assist with this investigation are asked to contact the Deputy Commissioner at telephone number 451-2467 or the officer in charge of the Criminal Investigations Department at 4561810 or any police station or police officer you are comfortable with. The police say all information will be treated confidentially. Meanwhile, the police have arrested and charged Veroni Billy, a 29-year-old unemployed of Union Island, with assault and resisting arrest. The accused man allegedly assaulted Corporal 192 Douglas Caesar by grabbing his neck and right hand, he being a police officer acting in the due execution of his duty. Billy was further charged with resisting arrest of Corporal 192 Douglas Caesar by pulling away from him. The incident occurred in Clifton, Union Island on October 19th about 8:18 p.m. Billy is expected to appear before the Serious Offences Court to answer to the charges.